Let's talk about the main differences between PVD and PAD. Let's look at the patho of PVD. This is when deoxygenated blood can't get back to the heart. So this causes pooling of oxygenated blood in the extremities. As for PAD, this is narrowed arteries due to atherosclerosis, where oxygenated blood can't get to the distal extremities. This causes the distal extremities to have no blood or oxygen, leading to ischemia and necrosis of the extremities. Okay, let's look at our signs and symptoms seen in PVD. Will these patients have pain? Yes, it's going to be kind of a dull, constant, and achy pain. PAD patients will also have pain, but it's more going to be a sharp pain. We call this intermittent claudication. They're both going to have pulses present. Now for edema. PVD patients will have edema. Remember, blood is pooling in the legs. As for PAD patients, these patients will not have edema. Remember, there's no blood in the extremities to cause pooling. All right, let's look at temperature. In PVD, they are going to be warm because remember, blood is warm and we have a lot of it. In PAD, the extremities are going to be cold because we don't have any blood in the extremities and blood is warm. The color of patients' legs in PVD tend to be brown or yellowish. We call this stasis dermatitis. And patients in PAD tend to be very pale in their legs because remember, there's no blood causing ischemia and necrosis. So the wounds in PVD tend to be irregular shaped and wounds in PAD tend to be regular in shape. You will commonly hear wounds in PAD described as a punched out appearance. Let's talk about gangrene. This is caused by insufficient amount of blood flow. So in PVD, do you think we're going to have gangrene? Well, no, because we don't have an insufficient amount of blood flow. We have too much pooling of blood. And for PAD, yes, we are absolutely going to have gangrene. That is our problem. We don't have enough blood. Next is positioning. We want to educate PVD patients to elevate their legs. You can think elevate for PVD. And for PAD patients, we want to educate them to dangle their legs. So the memory trick here is for PVD, we elevate, and for PAD, we dangle. That's all for PAD versus PVD. If you want more information like this, you can find it in the Complete Nursing School bundle. Happy studying, future nurses.